The National Department of Health today stating there were no cases and work is underway to have high-risk areas prepared should there be a confirmed case.
That as up to now, we haven't got any case of the coronavirus documented. And I think that point still stands in our country.
At the Jackson's International Terminal, 6,000 passengers have been screened, with 110 coming from affected countries.
6,000 passengers screened. 110 persons were of interest due to their travel history, and 3 persons with travel history investigated, and the samples have been collected from 2 contacts also. And these tests, we are waiting for them to see what the results will be. Now, as you heard from our WHO representative, the key certified lab in the country is Institute of Medical Research. And that's where these tests we are verified, and then we are clear about what the status of these patients are.
NDOH awaiting a submission to NEC for funding. The funds expected to be used to improve isolation facilities and get needed equipment to the land, sea and airports.
Just coming in from outside PNG, and so one of our partners has indicated they will bring this in. This is the thermal infrared, machines or equipment. With regard to the protective devices, WHO has upscaled us to be able to respond when we do have to get into that kind of gear and attire. But we know that that's not enough, and we are working up, stepping up to get the numbers increased to a level where when we do get into such a state, we'll be ready for it. So the message has gone out to our partners like DFED Australia. New Zealand has come on board with us to see how they can support and help. And so I would think that their support and help includes such equipment and support and help.
Meanwhile, WHO says there's still a long way before the vaccine is certified and calls on the public to continue hygienic routines.
And it's still, I think, the WHO now calling the global scientists to work on to develop the vaccine, and it takes time, and we don't know, and it's quite different from the pandemic influenza time, which Dr. Dakulala always referred to. For the pandemic influenza vaccine, we know how to do it. We know step by step, and because we deal the routine influenza vaccine, even the virus is mutated, but we still know how to do it. So it takes us 3 months to get the pandemic influenza vaccine, but this take longer and take months or years, and because they need a detailed safety assessment, the clinical trial, and also get approval from relevant organizations such as World Health Organization.
Adelaide Sirokskari, National, MTV News.